Our most common procedure that we perform in this hospital is Tibial Plateau Leveling Osteotomy, or TPLO. This procedure is used to treat degenerative and traumatic ACL tears in dogs. You know, the dog knee is constructed just like the human knee. We got femur, we got a tibia, and they make up this hinge joint. And the cruciate ligament's job is to prevent the tibia from sliding forward relative to the femur. And dogs typically degenerate their ACL. It's not a football injury, it's not a skiing injury, it's an old age, it's wear and tear, and there's genetics that help signal for the ligament to start to break down. But basically this is a breakdown chronic process where the knee starts to become unstable. And as the knee becomes unstable, the joint gets inflamed. The inflammation causes discomfort, it causes lameness, and it causes a lack of range of motion. All of those things lead to arthritis in the joint. Dogs don't have a very good long-term option for managing knee arthritis. In the hip and the ankle, we've got some great options, but in the knee, we don't have any. And so we tend to be very aggressive about getting the knee stable early so we're not dealing with arthritis later in life. And really the only way to get it stable is with surgery. And in a nutshell, we're gonna change the shape of the dog's shin bone and leave us with a knee that no longer needs an ACL. So the good thing about this is once everything's healed, we've created a knee that no longer needs an ACL. We can't tear it again in the future. So dogs, because they stand on all four legs, the top of their shin bone's not parallel to the ground. That's different from humans. We stand erect, the top of our shin bone's roughly parallel to the ground. Our human knee is nice and stable. Dogs, because they're on all four, their knee's pitched forward a little bit. And to make their quadriceps muscle more efficient, the top of their shin bone's pitched back relative to the ground. And the average degree of pitch for a dog is 28 degrees. So their femur sits on this natural 28-degree hill, and it's the ACL's job to hold that together. And basically what we're gonna do with this TPLO surgery is we're gonna change that 28-degree hill to about 3 degrees. So we actually take a saw, we cut the tibia into 2 pieces, but that lets me rotate this joint surface to drop the angle down to 3 degrees. And then once we've got them rotated down to 3 degrees, we use a special plate and screw system to hold those 2 pieces of bone together. The nice thing about this TPLO is we're dealing with bone healing, and those 2 pieces of bone tend to fuse back together in about 6 weeks. This gives us a really great, predictable outcome. Most every dog gets back to about 95–100%. Full activity, running, jumping, whatever they want to do in life with very little risk of having a complication in the future.